Yeah, well, you see, B12, pernicious anemia, uh, one of the symptoms of pernicious anemia is the neurologic. See, there's the anemia part and there's a neurologic part. This brought up an interesting thing, is that back 50 years ago, when the cause of pernicious anemia was discovered to be malabsorption of B12, and they started giving B12 shots. Now, for a few years before that, they knew that a person with pernicious anemia could go into remission by eating a pound of raw liver a day, but that was, I mean, that's better than death. But anyway, it worked. But anyway, pernicious anemia has two aspects. One is the neurologic and the other is the anemia part. Well, it turns out that folic acid would cure the anemia part, but not the neurologic part. And so that's why laws were passed to prevent the use of folic acid in multiple vitamin tablets over a milligram, you see. So that's why you see all these tiny doses of folic acid. And unfortunately, there's been a tremendous number of like birth deformities, sphingomyelia, where the spinal cord comes out of the kid in the back due to folic acid deficiencies because of this dumb law. You see, their thought was that if they allowed folic acid out in large amounts, that there would be people walking around who had pernicious anemia, that the doctors would think they had multiple sclerosis and not realize that it was pernicious anemia that could be cured with a B12 shot. So my thought is the doctor ought to be able to tell that, and maybe if somebody comes in with anybody who comes in with anything neurologic in my practice automatically gets B12 and folic acid to see what it does to them, you see. I mean, giving the shot is cheaper than the test. And so then you give the shot to see how the person responds to it. It won't hurt them. And and a lot of elderly people lose their memories, and I think that a lot of what's considered to be senile dementia or Alzheimer's disease can be prevented with B12, folic acid, B100 shots.
What kind of a dosage would you recommend for?
Well, again, we do this standard thing of 1 cc of each one of them and see how long the kick lasts. Now, when the person starts giving themselves their own shot, we try and teach them how to do that. Then I tell them, okay, vary the dose. Maybe take a half a cc of B12 and a half a cc of folic acid and 2 cc's of B100. See how that works, and then alternate around, see which one works the best. And so they find out something that meets their own biochemical individuality. See, I mean, this is the key. One of the major keys of orthomolecular medicine is to see, we're not interested in a statistical average of how a drug works. Like, you know, you do a double-blind study on 1,000 cases of a certain disease and study a drug. And let's say it cures 2 of them, but then they say that's statistically not significant. Well, it sure was statistically significant to those 2 people. See? And so we recognize biochemical individuality, and then we try and match the treatment with the person. And this involves a lot of trial and error, you see, a lot of history taking. And so far, the tests are not that great. I mean, maybe we're getting better and better at the tests, but I think the major thing is to try these nutrients on people and see how they respond to them.